Hello everybody. So let's put the music up. We're going to get started in just a couple of minutes. Again, I'm on Facebook and I've got my phone here. I'm on Instagram. Hi everybody. Hi, great to see you. So today the topic of discussion is my 5 top tips to getting started in implant dentistry. So as I said, we'll get started in just a couple of minutes. But before I get started, I just want to let everybody know about a series of webinars upcoming next week all around full arch implants, and I've got the details here, so I'll just tell you about them. So my charismatic colleague Martin Wanendia starts off the week on the 21st of April at 7:30, and he's talking about FP1 versus FP3. Martin is a really charismatic, fantastic speaker, and that's really one to tune into. Then Marcus Gambrodis on the 22nd of April at 2 p.m. He's talking about restorative choice in full arch implant therapy. Then Paul Swanson from Liverpool, case assessment and consent for immediate full arch reconstruction. That's the 23rd of April at 6 p.m. Amit Mistry from Manchester, achieving primary stability in full arch implant therapy. That's on the 24th of April at 1 p.m. Then myself, I'm talking about pterygoid implants on the 24th of April at 6 p.m. The wise and very knowledgeable Bill Schaefer will be on the 25th of April at 7:30. He's talking about how to do full mouth immediate full arch load in one day. My dear friend Abid is talking about full arch implantology, the guided solution on the 27th. Guy McClellan, extreme neo-arch and trans-sinus implants. That's the 28th of April. And then finally, Harpal Channa, 18 years of zygoma implants. Wow, what have we learned? That's the 29th at 2 p.m. So there are so many webinars going on next week, all around full arch. Tune in. If you're on Facebook and Instagram, you'll see various links. I'll post the links on my feed as well. But, really, I'm surrounded by absolute greats. So Martin Wanendia on the 21st, Marcus Gambrodis, the 22nd of April, Paul Swanson on the 23rd, Amit Mistry on the 24th, myself again on the 24th, Bill Schaefer on the 25th, Abid Fakir on the 27th, Guy McClellan on the 28th of April, and then Harpal Channa on the 29th. So you'll see this all around Facebook, Instagram. Guys, sign up. It's going to be a fantastic week to gain further knowledge all around a full arch. I know myself and my colleagues, there's going to be Q&A afterwards. There are going to be lectures that are 40 to 50 minutes, and we'd love to see you all there. So I hope and I'm praying that everybody is well. Everyone's doing really, really good. Everyone's safe. Can I get a thumbs up? How's everybody doing? Let me know. Today's topic of discussion, 5 keys to start your implant journey. Now, if you're new to implants or keen to get started, ask me a question. I'll tell you about my experience and how I got into implant treatment and what I've done to develop my implant career. So the 5 things I'm going to talk about, I'm going to talk a little bit about courses, I'm going to talk about mentoring, I'm going to talk a little bit about branding, I'm going to talk about how to get the cases and how to get yourself started into implants. So, you're on a course and you want to bring what you've learned on the course and just get started, how to do that, and then talk a little bit about how actually we need to start simple, be very selective on the cases that you start with. Okay, so if there's any questions regarding starting your implant journey, then please post. As I said, I'm on Instagram, I'm on Facebook. I will post the link to these great webinars that are coming next week all around the topic of full arch implant treatment. So first of all, courses. Starting off your implant dentistry journey, courses, of course, are really important. There's so many out there. How do you choose? Well, really, there's courses that you can attend that are hands-on, there's obviously lectures, there's online. And really you want to be getting advice from other colleagues around you, either colleagues that you work with or other colleagues within implant dentistry, to see a course that would be best tailored for you. And if you're starting off, you also need to be just a bit wary about the investment that you're making. What you don't want to do is sort of tie yourself in for £20,000-30,000, and then it turns out that you don't then go ahead and pursue a career doing implant treatment. We know that many people start their journey in implant dentistry, and a year later, it's less than 20% are actually then placing implants. So how about keeping your investment sensible, maybe somewhere less than the £10,000 mark to get yourself started? And look, during lockdown where we're at home, this is a great time to start. People think, well, I wouldn't want to be starting. No, this is the time. If you're keen to start implants, this is the time. There's an abundance of knowledge and teaching out there, webinars, there's online courses. I'm doing an online course, for people that want to learn about full arch. There's so much out there. Have a look, and this is the time to start if that's what you're keen on. Start an implant dentistry. So there's courses, there's webinars, there's online courses. Have a look, ask colleagues, think about the investment that you're going to make now, and then you've also got to plan how are you going to then reap the rewards, because if you've put an investment of, say, £10,000 into a course, you want to know how you're going to get that money back, because ultimately you need to, for you to keep going with that, you want to be seeing, the return for that. So that's the first thing. So courses, it's important. Deciding on what courses, ask other colleagues, get their advice. Second, a mentor. I talk about it in a blog that I did recently. I talk about mentors and heroes. I am where I am in implant dentistry because I've had mentors from early on. I've had people guide me and help me at every stage. So when I talk about a mentor, I'm talking about someone that has a vested interest in your growth and development as a clinician. I also talk about heroes. And a hero is someone that you see out there that is putting their work out there for you to look at and aspire to. So there's mentors and heroes, and we all need mentors in our career as clinicians, and we need heroes, some people to look up to aspire to be at their level. And as I said, I'm where I am because I've had mentors, and I wouldn't be anywhere near the stage I am in my career if I didn't have mentors helping me along the way. So that's really, really important. Identify the mentors, and there's various ways you can find mentors through the internet. There's mentor lists, etc., etc. Or ask other colleagues, within your own practice. If you've currently got dentists within the practice doing implants, maybe they'll mentor you. Maybe if they're not willing to mentor you, look for a mentor that's works in the surrounding area. Tip number 3, branding. You got to stand out. Get yourself a logo. You get yourself a logo and develop a niche for yourself within your practice, within your area, and after you've got a course, you've got a mentor, you want to keep the impetus and keep the momentum up. You don't want to let yourself down when you've invested so much money into your training. So get a brand, get a niche, and use social media to benefit you and propel your career forward. Look, we've got Instagram, we're Facebook. So I'm on Instagram, I'm also on Facebook, I'm also on YouTube. Use these platforms to further your career. The top search engine in the world is Google. After Google, it's YouTube. So get yourself a YouTube channel and put yourself out there. So as to market yourself the best way, our patients and colleagues look at these platforms. So you've got to make yourself visible on these platforms. So Instagram, YouTube, Facebook. As a clinician, you want to develop and grow, you need to be on these platforms. Also, there's a world of information on these platforms through social media groups, engaging with other colleagues. Look, we're all sitting at home during this period of time. And dentists are, you know, I was speaking to an implant dentist this morning, giving him advice on a course, on my online course. And, you know, we're at home and we're willing to share our knowledge and give advice. So, you know, through Facebook and Instagram, you can find anybody and drop them a message. I'm sure they'll be more than happy to help you and guide you on your journey. Okay, so what about tip number 4? Once you've got your course, you've got a mentor, you need the patience. So one of the best ways to start getting your patients is you need to sort of have that relationship within your practice. If you're an associate or if you're a principal, it's a bit easier, but you want to be giving the first few cases, you want to do them at a discount level because your information's fresh in your head from the course. You just want to get going. So to get your numbers up and get that experience, do some cases discounted, you know, because that'll then fill you with confidence if you can, you know, just keep that momentum going. So do discounted work to get your first maybe 10, 20 implants under your belt. And remember, when you do a favour for patients, they're your biggest advocate. You know, word of mouth is the strongest way to get more patients. So if patients would be grateful for that, and then they're going to go out there and then they're going to sell your praise, and then you're going to get more patients on the back of that. So think about doing some discounted deals when you're first starting off. The 5th is start simple. Pick your cases really wisely. What you don't want to be doing is, if you've freshened an implant case and you want to start on a full arch, it's not the way to go. Start simple. Start with an upper or lower, maybe a first molar, an abundance of bone, just what we'd call a slam dunk case. Start simple. You know, I can't emphasize that enough. Also, in your implant journey, you want to start with, you know, set yourself goals. Really, really important. So set yourself goals that are attainable. So maybe set yourself, you know, this year I want to place 50 implants, and write it down and focus on that number and think about it on a regular basis. But it's not enough just to set the goal. You've got to ask yourself every week or every day, what am I doing to achieve that goal? And not only implant number goals, you need to set yourself skill goals. So how are you going to develop as an implant dentist? Because it's not just about, you know, putting in that screw. Set yourself a target in terms of skill level that you want to achieve, and how are you actually going to get there? So it's not enough to say, yeah, I want to become proficient in grafting and I want to do 100 implants a year. That's not enough. How are you going to get there? So is it through mentorship? Is it through doing more courses? Is it through going to visit other clinicians and watching them work in their practice? Look, I have numerous clinicians that contact me all the time. They want to come and watch. And how that's really come about is when I used to be mentored doing implant dentistry, my mentor would have numerous people around us watching, and it really is the best, you know, the way to really develop yourself. Contact clinicians around your area that are known as experts within implant dentistry. Contact them and ask them if you can come and watch, because I can tell you most of the people I come across and myself are more than happy for other colleagues to come in and watch, and so we can all learn together. So as I mentioned, sort of my 5 top tips in terms of getting started in implant dentistry. We're talking about courses, mentorship, brand yourself, you know, develop a niche. Think about how you're going to get the numbers for, you know, your implant cases. So think about maybe discounting the first few cases and start simple. So that's my 5 top tips in getting started into implant dentistry. We're at home. This is the perfect time. We shouldn't be just sitting about and thinking, oh, well, actually, I can't really develop an implant dentistry or start it. Absolutely, I disagree. This is the time to start. As they say, sharpen your axe while you're at home. Sharpen your axe so when we're back at work, you can, you know, hit the ground running. So think about courses, think about mentoring, engage with people over social media, within your community, within the area that you work in. Engage with them, thinking about branding, how you're going to get your name out there, how you're going to promote yourself. Think about how you can market yourself within your clinic. If you're not the principal, then, you know, as an associate, start having that discussion with your principal now. You know, I want to start doing implants. How do you think we can market this, etc., etc. And join. You know, I'm fortunate enough to be a committee member within the Association of Dental Implantology, the ADI, that, you know, and I'm surrounded by giants in implant dentistry, and that's one thing I would really sort of you know, hit home about, is when you surround yourself with people that are better than you, then you are pushed to be better. So surround yourself with clinicians that are much better than you, and then you have to get better. You know, if you're a loser and you've got 9 friends that are loser, you're going to be the 10th. If you're poor and you're surrounded by 9 poor people, you're going to be the 10th poor person. That's the thought process. If you surround yourself by great clinicians, then you will push yourself to be a great clinician, because it's just the way that the mind works. You're pushed. So courses, get yourself a mentor, think about it, have people that you aspire to be like, think about branding yourself, think about engaging in social media. Look, I'm on Facebook, I'm on Instagram, I'm also on YouTube. Use these platforms, put yourself out there, and use them, because they will help you grow as a clinician as well. Think about discounting initially to start yourself off, and remember, start simple with your cases. Don't be just jumping ahead. So I just want to quickly go over a series of webinars that are coming next week, and I hope you will be able to join us. So next week, 21st of April, Martin Wanendia, the very charismatic Martin, will be talking about FP1 versus FP3. And then on the 22nd, my dear friend Marcus, restorative choice and full arch implant therapy. Then Paul Swanson will be talking about case assessment and consent for immediate full arch reconstruction. Amit Mistry on the 24th of April, achieving primary stability in full arch implant therapy. Then myself, I'll be talking about pterygoid implants on the 24th of April. Bill Schaefer, the wise, the knowledgeable, how to do full mouth immediate full arch load in 1 day. Abid Fakir, my dear friend and one of my mentors, full arch implantology, the guided solution. Guy McClellan, the first person I saw doing a zygoma implant about 5-6 years ago. When I saw him, I said, I'm never going to do them. But actually, I ended up following, and I do a zygoma implants. Guy McClellan, extreme neo-arch with transinus implants. Harpal Chana, 18 years experience with the zygoma implants. I cannot wait. That's on the 29th. Look, I know I've just reeled off a number of people talking and dates. The links to these webinars will be on my Facebook. They'll be on Instagram. You'll see them all over the place. Please sign up. It's going to be an action-packed week, and there's going to be a lot of, hopefully, Q&As afterwards. So please get involved, sign up, share and like the post so we can get it out there and get as many people involved as possible. There in itself, you know, that's a book. You know, everything that you'd find in a full arch textbook is all there in webinar format, and it's all free, and it's all next week. So we'd love to see you there. Right, any questions? Let me just go to Instagram first. So the topic of discussion today was the 5 tips to get started in implant dentistry, and as I mentioned, we talked about courses, having a mentor, thinking about branding, thinking about discounting to get your first few cases in, and 5 starting simple. Okay, so that was my 5 top tips. Have I got any questions? You know, on Instagram, if anybody would like to come into and join me for a conversation, just a chat, why don't you click the request a chat button and we can have a chat. I don't mind having a chat. Did anybody? Yeah, there, someone wants to have a chat. Great. I'm adding them in. We can have a chat. Any questions here? Thank you for all the kind messages. Thank you everybody for the kind messages. I am well, thank you. A lot of familiar faces, getting a lot of nice comments. Thank you guys. Anybody want to have a chat on Instagram? You can, Instagram's great. I'm a big, huge fan of Instagram. It's a great. Someone wants to chat. Let's see what this is. So Facebook, you won't be able to see who I'm chatting to, but people on Instagram will be able to see a split screen. But it's not always possible. No. Does anybody on Instagram want to come on, have a split screen and just have a chat? Should we, Imran, Slams, how are you? Should we stick to Straumann? Why would you not stick to Straumann? Are you having issues? Straumann is a fantastic implant system. It is one I am very familiar with. I don't have issues with Straumann. It's not my go-to implant system, but why not? Why not? Tell me, are you having issues with Straumann's? What are your issues? We can discuss them, no problem. Is it a good time to get into a course now, knowing that there might be financial obstacles to patients paying for implants post-lockdown? Absolutely, yeah, this is the time. Sharpen the axe, start increasing your knowledge within implant dentistry. There's courses, there's webinars. I'm running an online course. There's loads of free webinars. Financial difficulties, yeah, we're all under financial difficulties, but people will still always want dental implants because it's the gold standard to replace a single tooth. So, if you're out there and you've got the knowledge and you've thought a bit about marketing and branding yourself, then you'll pick up the implant patients. So, absolutely, we can't have the attitude where we're thinking, there's an economic crisis, and let's not start learning about implants. No, this is the time. We're at home. I've got a bunch of books. If I could show you here, I'm reinforcing my knowledge. I'm learning new things all the time. Could you send me a link to your online? Yeah, absolutely. I will do that. No problem at all. Anybody on Instagram that wants to chat, click the request button and I will chat to you. So I've clicked someone. I'll see if they come in. Could you? Sure. Great. Any questions on Facebook? So we've talked about the 5 top tips to getting started in implant dentistry. And as I said, lockdown, great time to start. There's so many webinars out there. They're free. Sign up. Soak in the knowledge. Think about courses. Think about finding a mentor. Think about branding yourself. Think about discounting your first few cases. Chat to your principal if you're an associate. How are you going to market yourself? How are you going to market the practice? And remember, when you start simple. Get yourself the right mentor. I've got mentors. I still have mentors. That's the best way to grow. The best bit of advice I ever... Oh, did I get advice to get a mentor? I can't remember. But I kind of fell into a mentor, someone that helped me along the way. Still helps me. Invaluable. I wouldn't be where I am without mentors, without help. We can't, certainly we can do things on our own, but why wouldn't we do it faster? If you have a mentor, you can do it faster without a shadow of doubt. Anybody wanting to chat on Instagram? No, nobody's, Oh, maybe. No. I've asked someone else, see if... Thank you for all the kind comments. I've been talking for about 20 minutes. So one final time, I'll talk about my 5 tips Courses, think about courses, chat to people, get advice. Don't just do a Google search and just pick a course, ask people, you know, contact people that have been on the course before. When you contact the course, you know, admin team, ask them, can you put me in touch with people from previous cohorts? Ask them what it was like and see how they are and how their development's been, what the good points are, what the negative points, and think about the cost, you know, think about that investment, think about how you're going to get a return on that investment, your ROI in the long term. What about a mentor? Think about mentors, you know, have a mentor, identify mentors, also think about heroes, people that you aspire to be like, are really important. So mentors and heroes. When I talk about mentors and heroes, that's not something I've come up with. There's a really good guy in America called Seth Godin, and he talks about mentors and heroes, and I've taken it from him and just copied it into a, you know, dental implant. So mentors and heroes, and I did a blog on that on my Instagram account, and you can have a read. Think about branding, you know, brand yourself, you know, develop a niche for yourself as a clinician, you know, and utilize social media, utilize Facebook. I'm on Instagram, I'm on Facebook, I'm also on YouTube. You know, world of information, and it allows you to connect with other colleagues and with patients. Brand yourself. How about, you know, when you've done your course, thinking about how you're going to get patients, think about discounting the first maybe 10, 20 cases. Maybe you treat friends, family, maybe you treat the staff in the clinic. So think about that and start simple. I hope that was helpful. I'll be back on here next week. If there's something you would like me to discuss, something you'd like me to go over, please drop me a message, email, put a message up here. I'd be more than happy. I am guided by you, no problem at all. And remember, next week, an amazing series of webinars. They're going to be filmed. It's going to be live. An amazing series of webinars. Some absolute giants plus me talking about different aspects of full arch implant dentistry. So I hope to see you all there. God bless. Take care, everybody. Have a fantastic weekend. Stay safe.